You are listening to 1330 WRAM and FM 94.1. I am Cheri Bustos, your U.S. Representative in Congress. And again, this is my 100th Cheri on Shift. And today I am broadcasting from WRAM studio, conducting interviews with members of the Warren County Emergency Response Team, as well as community leaders and employers. So for this segment, we have Monmouth College President Clarence Wyatt with us, and we also have Jenna Link, who is the Warren County Health Department Administrator. I'm going to start with President Wyatt, if we can. And this ties in very closely with what we're facing as a world. I mean, we are now in the midst of a healthcare pandemic. And President Wyatt, you had some students who were overseas and who just came home. Can you talk about what happened with your students?
Well, we can't. They were on it was our corral, and they were on a tour that had been arranged for some time. Of course, we were closely monitoring situation in the two countries that they were traveling in, which was Austria and the Czech Republic. They had remained normal situation throughout their trip, but then, of course, as the situation evolved and we started getting different directives from the federal government, we worked to bring them home, and want to take a moment to thank you and your staff for being there to backstop some things if it was necessary. They got home Saturday night fine in Chicago. They missed most of the mess at O'Hare, although they had to deal with it somewhat, and again had some conflicting directives. But what we have done is and had consulted with Jenna, those students have now self-quarantined at home, except for 6 students who had, to put it bluntly, no place else to go. And we have followed Jenna's advice in terms of how they are self-quarantining. They are doing symptom logs, all of those things. And so we're following the Warren County Health Department's advice and guidelines in that.
Well, I have to compliment you for, here you are president of a college, and you are involved directly. I know you talked with us directly about your concerns for your students who were coming home, and I want to compliment you for your hands-on approach to this, because you don't always have the person all the way at the top who's taking the care with this that you have.
Well, I appreciate that, Congresswoman, and again, thanks to you and your office for all of your efforts, and I know that we'll be working closely with you because this is going to have a financial impact on the college, as it is our local community, and appreciate your efforts in terms of being sure that there's an appropriate congressional response to this. And so thanks again, and for all that you have done and all that you're going to do.
So let's look at this and play this out a little bit. You have suspended classes, so let's talk about what's ahead.
Well, and let me actually what we have done, we are continuing instruction.
Okay.
We are working. We are providing. Our twin commitments through all of this have been to continue a quality education for our students and to safeguard the well-being of our community. And how you serve those two imperatives obviously has evolved as the situation has evolved. We made the decision Saturday night, yesterday, to move totally to remote learning is the phrase that we're using.
Okay.
So our students will be, actually they were on spring break last week. We had earlier made a decision to extend spring break for this week, to cancel classes, to allow our faculty to begin to prepare to go to remote learning. We had originally hoped to be able to do that in sort of a flexible way, but as everybody's been dealing with, things change, and we decided that this was the appropriate response. And so we're going to continue, our students are going to continue to take their classes. They're going to be able to complete the semester successfully. Our seniors are going to they will complete their degrees, and so we are absolutely committed to that. We're just going to be doing it a little more creatively.
Yeah, of all the things as a college president that you think you're going to have to deal with, I doubt a pandemic is one of them.
When there are a number of programs that you can go through that are available to you as a new college president, and I went through one of them, and there was not a session on pandemic, as I recall.
Well, and Jenna, I doubt that you saw this coming. I don't think any of us saw this coming, right?
Well, I would back that up just a little bit and say that in the state of Illinois, we've been talking about pandemic flu planning ever since 2009 when H1N1, and even before that, we had plans in place for doing the mass dispensing clinics with the H1N1 vaccination. We've continued to do those planning meetings, but not quite to the extent that we're seeing right now. Last fall, we did a statewide functional exercise with public health where we kind of played through a scenario with a bird flu coming from China, and lo and behold, 6 months later, here we're talking about a virus from China. So, there's been discussions, but we haven't had to play that out. We haven't had to put that to an actual exercise, and so now we're still learning.
So what are you seeing on the ground?
So it's been a little hectic. Just the guidance changes day to day as those numbers continue to go up. We tried to do, all of our partners have been getting together and talking about best plans, best practices, what do we see happening, and we were kind of like preparing for when we get that case and what do we do there. And over the last few days, things have totally shifted, and we're like, okay, now we're putting things in place before that first case gets here to try and slow down the progression of that disease. So it's totally shifted kind of our focus and our plan and our strategy, having to be very flexible, constantly in contact with all of our partners, 24/7, we're all available. So just adjusting as these directives continue to roll out.
Have you been involved with any of the testing of people who suspect they might have coronavirus or feel like they need to be tested?
I have not to this point. We have put protocols in place between us and our healthcare system because they ultimately have to call the health department to get approval for that test. They call either the local health department or the state health department if they can't get in touch with us. But there's a protocol you go through. There's a priority group and that's continuing to shift too as we're seeing community spread in certain places. Initially it was those that traveled to China, and now that list of locations has expanded. Or have you traveled to a location where there's known community spread, or are you at higher risk for having been exposed? So there's a series of steps they have to go through before the provider would request such a test.
Okay, and so that can all be handled by telephone initially?
There will probably need to be some face-to-face. If there's mild symptoms, over the phone, they're probably going to tell you, stay home. Mm-hmm. If you are having the more severe symptoms, such as shortness of breath and difficulty breathing and a cough, then they're going to need to see you. But we're really stressing to everyone, call ahead before you go. Make sure you're telling your healthcare provider, I have traveled or I have been exposed to somebody that possibly had COVID. I have been in isolation. I have traveled. I am at risk of maybe having, so that they can meet you at that front door, and they have plans for directing you in a certain location so they're not exposing everybody else in their waiting room. And so it's really important, to follow that directive.
And you're saying that call, at least in Monmouth and the surrounding communities within Warren County, are to be to you or to their respective county health departments
for that testing. Yes, all of those protocols have been established from IDPH down, federal, CDC, down to state, down to local. So those things have been put into place so that that chain of information, reaction, and testing is well established.
Now, would you go to a person's home to do the testing? I guess it's a swab, is my understanding, is how the test is initiated?
We are not planning to do that through our department. We have a very small staff. I have 1 full-time nurse and 3 part-time nurses. They're all very designated to certain specific programs, and just to have the setup to be able to do that, PPE, for example, personal protective equipment, that isn't something we do on a day-to-day basis, and I don't feel our staff is equipped to do that.
Okay, so the call goes to you, and then what do you do with that call then if you're not going out and doing the testing?
The call would come from your healthcare provider's office. Okay. So as a patient, you are in your doctor's office. They've done their evaluation. They think they've ruled out influenza. They've ruled out several things and gotten down to the point where they think, oh, we might need to test for coronavirus. They call the local health department. We walk through that evaluation. We call the lab. We get an approval number. That's attached to the specimen, and the specimen is sent to the state lab. And that's the process in this area.
The test itself then is done at the physician office.
It's the physician office. The collection of the specimen is done at the physician's office.
Is anybody talking about drive-through testing or anything like that at this point? I know we have not had any confirmed cases here.
I think there's some conversations about that long-term when we start seeing more numbers, trying to set such a thing up. I can't give you definite details as to right now. But
Let's
that
talk.
would be
Let's
an
talk
option.
about behind the scenes. So people are out there. We just talked with Jackie Kernan, who's president of OSF Family Medical Center. We talked about the worried well. You know, this is dominating the news.
Right.
You know, and obviously we've got colleges that are doing the online learning and adjusting that way. We, as of tomorrow, we have our public schools that are closed. As of last thing tonight, we have all of our restaurants and our bars that are closed for in-dining experiences. So this is dominating. What is happening behind the scenes with healthcare providers, with OSF, with the public health department, with the community health centers, with and for that matter, even I don't know how the chamber is being brought in this to address it from a small business perspective, but what is happening along those lines in the conversations that are being had?
Well, for us, we're sending people to the CDC websites or to the public health website. There's all kinds of guidance there, no matter what kind of business you do. There's business, there's hospice, there's schools, there's universities. It's all there with strategies for how you minimize the impact of this virus in your business. And we're really trying to stress right now the social distancing, 6 feet apart for less than 10 minutes, reducing those gatherings, large gatherings where more people can be exposed. That's the strategy, is to try and slow down the progression of the disease so that it doesn't overwhelm our healthcare system. If we do nothing and we see a huge spike and we have a lot of severe cases, the healthcare system, who's still recovering from seasonal flu this year, will be completely overwhelmed, and it will be difficult to treat those with the severe form of the illness because they're going to be short on supplies, short on staff, etc. So that's really the strategy. It seems a little overwhelming right now. I think people are still trying to adjust and make plans. We've been saying all along, make sure you're prepared if you have to be home for 14 days. And that keeps coming a little quicker than I think people have anticipated it, but that's because we're really trying to get a jump on the spread of the disease.
So just to get back to President Wyatt of Monmouth College here, your clientele are students, that range in age from 18-ish to 21, 22-ish, who think they're impervious to to getting sick and just everything will be fine. How are you dealing with that part? Obviously, you're doing the remote learning, I think is how you characterized it. But what about like the psychological aspect? If you're a senior and all of a sudden this is happening in your senior year, just all of that.
Well, and that is, and of course that's all just has now evolved over the last few days, and really with the decision to go entirely to remote learning just within the last less than 24 hours now. But we are, and they are, in fact, as a member of our staff said, they are grieving. And that's not an inappropriate word for this. And all of us have talked about it. My wife Loie and I were talking about this last night and again this morning. And our senior staff has talked about this too. What are things that we can do to maintain to continue to have all of the traditions of spring at Monmouth College, and especially for our seniors? And how can we virtually recreate all of those experiences that our students have? How can we keep them in touch with the campus? I think that certainly applies to us, but I think it applies to every sector of society, that as we prudently do the things that we need to do to restrict economic activity, to do the social distancing, as we do all of those things, let's also try to think about ways that we can maintain the human touch, because that's what will get us through this. If we all hunker down, if we start, we naturally enough are going to worry about our communities, our families, and all that. But the degree to which we can maintain some humanity and some human connection in this, that's what's going to mitigate the disease. That's what's going to get the economy going again. And maybe, just maybe, this can be a positively defining moment for us.
And so, from an economics perspective, I mean, you are a major employer in Warren County. Probably one of the biggest employers.
Second biggest, yeah.
Second. So how does that play out? And I know this is an evolving crisis that none of us had control of as far as it coming into our community or surrounding our community. But what do you talk about, and how do you figure this all out?
Well, and again, you're partly figuring it out on the fly, just as
Yeah.
everybody else is. But our first and foremost, our commitment is to continue the education of our students. So that then dictates certain things you're going to do. The faculty obviously remains employed. The faculty is going to continue to do its thing. We are committed to having, even as the in residence footprint on campus drops dramatically, we will end up with some very small number of students still on campus, frankly, because some of our students have no place else to go. We're going to maintain our staffing as absolutely as much as we can. We're figuring it out, but our commitment is to take care of our folks the absolute best we can, and it's going to have an economic impact on the college. We knew that from the get-go, but we'll get through it.
Have you had to, again, I'm getting ready to ask you a question. I'm thinking this is so new. I don't know how you adjust to it this quickly, but is there technology now you will have to invest in to make all of this work?
Well, fortunately, we had a lot of it in place already. Faculty used it to varying degrees. When I was a full-time faculty member before coming to Monmouth, and I was not the most technologically advanced guy. I was a history professor, and for me, a chalkboard and a piece of chalk was about as high-tech as it got. But we already had a lot of technologies in place. Where, in fact, we started plan last week. We are engaging in a series of training sessions for our faculty this week to help them get up and running on that technology if they weren't already using it. We did invest in an expanded license for Zoom. We had a smaller license, but we've expanded that license, and people are being able to use that as a credit to our faculty. They immediately engaged in sharing information about, well, what are you going to do with your class? How are you doing this? I know how to use this. Can I help you use that? So that additional investment in technology has been pretty minimal because we had some pretty good stuff in place already. It's just a matter of gearing ourselves up to use it more effectively, more rapidly than any of us could have anticipated.
Yeah, you have a number of students who come from overseas who are already here on campus. I'm guessing those are among some of the students where you're thinking, right, it's not like you can just call mom and dad and say, hey, I'm going to have to hang out at home for a little bit.
That's right. No, and they're among the population, obviously, that we're going to pay special attention to in terms of continuing their education, and many of them will end up remaining in residence here for the remainder of the semester.
So Jenna, this is Jenna Link, Warren County Health Department Administrator. You have had to evolve in a very quick amount of time. As you said, you've studied what you do in the event of a pandemic. After H1N1, the last, I think that was actually deemed a pandemic as well.
Mm-hmm. It was.
From a technology perspective, or from just evolving how you do business in a very short amount of time, what are you experiencing?
Well, we have many systems in place. We have access to a virtual EOC where basically our emergency operations center could be done online. Everybody would log in, so we wouldn't necessarily have to meet in a particular location. We have it's called INEDS. It's a disease surveillance system where the hospitals are entering in information and we can monitor and see what's going on through that. We have a web-based, it's called REDCAPS. It is for the symptom monitoring. So when we have a case identified, it's the health department's role to do the case investigation and locate all of the close contacts. So from one case, we might have 50 people that we're notifying that we're in touch with that patient, and now those individuals will be under a 14-day isolation or quarantine. And so we can put them into that system and they log in twice a day, and so remotely through the computer we can see who's reporting symptoms and what those symptoms are doing without having to go to their homes. So that it's just all of those things were already in place. We're kind of having to learn on the fly how to use some of them because we don't use them on a day-to-day basis. But
so technology can be our friend.
It can
Yes.
be. Let's just hope it continues to work.
All right, we are going to have to wrap up this segment that we have with Jenna Link, Warren County Health Department Administrator, and also with Clarence Wyatt, the Monmouth College President. I want to thank both of you for being here. You are listening to 1330 WRAM and FM 94.1 Monmouth, Illinois. I'm Congresswoman Cheri Bustos, and we'll be right back with more.